Thank you, Mr. Chairman. Mr. Secretary, you're a named defendant in Texas versus U.S., correct?
Yes, I'm one of them, yes.
Is it true that this administration has taken the position that it will not defend the Affordable Care Act in court and support striking down the entire law?
The position of the Justice Department is that the individual mandate is unconstitutional and that as a result the other provisions in it are not severable from that individual
So
mandate.
in essence it would strike down the entire law, and the Justice Department is part of this administration, is it not?
Yes, they represent the administration in the federal courts, yes.
So therefore it is the administration's view that the entire law of the Affordable Care Act should be struck down. So if it's struck down, what's your immediate plan to replace it? If tomorrow the court decides that in fact the entire law is struck down, millions have health insurance who didn't have it before. Many under the Medicaid expansion have health insurance that didn't have it before. Millions have protections against pre-existing conditions that didn't have those protections before. Millions have no more lifetime cap, a ceiling on the expenditures that they have, especially if they have a serious illness. So what's the administration's plan? I haven't seen it yet, and I think this committee has jurisdiction.
So the litigation still has a very long way to proceed. The Fifth Circuit, as you know, has remanded the case to the district court for a very searching, detailed analysis of every provision.
Why are we going to wait? Why would you wait with the health care of millions of Americans and their fate to see what the court decides? It seems to me we've been hearing about killing Obamacare since it was created. There have been years to have your own version of what it is. Why would you wait till there's a disaster to then deal with the millions of Americans who have health care insurance? See this young man? He's alive today because of the Affordable Care Act. And like him, millions in my state and across this country are alive because of it. I don't know what you're waiting for. If you have a better idea, show us. But I have yet to see one plan that the administration has put forward over the health care of millions of Americans. What are you waiting for?
We would wait until there's a final judgment by the final court of authority. In this case, it would obviously be the Supreme Court. There is a very long process to go to even see whether the statute is struck down or even in part is struck down by the Supreme Court. These are hypotheticals at this point. We are faithfully administering the ACA now.
Well, let me just say, Mr. Secretary, these are hypotheticals that we don't play with. This is not some abstract consequence if it happens. Not some abstract consequence if it happens. Let me ask you this. The President's 2021 budget calls for zeroing out CDC funding for gun violence research. Did the NRA tell the administration to do this? Did you have influence from the NRA to zero out funding for gun violence research?
I've got no idea about any interactions there. I can tell you why we didn't put that in the budget is we have a tight budget. We have a 9% cut at HHS because the caps, the discretionary caps for this year go from, I think, 7.5% in 2020 to a plus 1.5% or 1% increase in 2021. We are the largest non-defense discretionary part. We absorb a disproportionate share of that. And so we had to prioritize. I prioritized towards infectious disease, global health.
If we didn't have $1.5 trillion tax cut unpaid for, driving huge debt, and we weren't further plussing up the military beyond everything that has been done, you'd have some money. It seems to me that understanding the consequences of gun violence, how we get around it, would save lives here in the United States. One of the priorities of a government is to save its people. Well, let me just ask you one final question in the less than a minute that I have. The Remain in Mexico policy, misleadingly called the Migrant Protection Protocol, has forced over 60,000 asylum seekers to wait in dangerous conditions in Mexico for the U.S. Immigration Court hearing. Over 800 cases of murder, rape, torture, kidnapping, and other violent assaults against asylum seekers returned to Mexico have been reported. What mechanism or process is there in the Office of Refugee Resettlement used to identify and track children affected by the MPP? What does ORR systematically notify when an MPP-affected child is identified?
Well, as you know, HHS and ORR have no role in determining eligibility for the MPP, which aliens are enrolled in that, or whether an alien is allowed to enter into the United States. And if a child comes in unaccompanied, then it would follow the usual unaccompanied alien children program protocols. If a child returns with their family to Mexico as part of the MPP, that's not subject to the statute and ORR's jurisdiction.
Yeah, but to the part that the child is unaccompanied and ultimately is returned to family in Mexico, are you doing any tracking through MP? No.
If children are determined to be enrolled in the MPP and ORR and DHS determine the child's parents are in DHS custody, or if they return to Mexico and leave the child here, we collaborate to ensure that we can safely reunify the child. DHS determines whether there is a criminal history that would preclude reuniting. We coordinate to DHS informs ORR's intake teams that the child's referral is with a family enrolled in the MPP. So that we try to keep track of everybody. If a child comes to us at the family's request that they decide to return to Mexico and leave the child here, we work with DHS to keep them in contact as we do with any child in our care to make sure they're in telephonic contact with the parents as regularly as possible. So we track that between them whenever we receive a referral like that.
Senator Cardin.